This lecture is on sickle cell anemia. Sickle cell is a type of congenital hemolytic anemia that is an inherited autosomal recessive disorder. Mostly you're going to see sickle cell anemia in your African American population, but it's also common in individuals of Mediterranean descent. So I mean, like Greek ancestry, you see it. You'll see it with individuals with Turkish um, components in their genetic makeup. So it's not just the African American population. It could be anybody with this autosomal recessive disorder. Okay. What you're going to see here is you're going to see abnormal red blood cells that are going to impair circulation, which is going to result in a chronic ill health, periodic crises, long-term complications, and often premature death. Um, what you're going to see in terms of this diagnostic wise, I probably should have done the signs and symptoms first, but we'll talk about diagnosis instead. Diagnosis with this is they're going to do a sickle dex. That's a specific type of test that they're going to actually look at and determine if we actually are dealing with sickle cell anemia or if we're dealing with another component. We're going to look at our CBC. The CBC will show low red blood cells and elevated white blood cells and platelet counts, and hemoglobin levels could be low or even normal. We can look at an ESR. That a lot of times is going to be decreased. We can look at serum iron levels and reticulocyte counts, which will also be increased. These are going to be the way that we diagnose this. Usually what you're looking for specifically with that sickle dex test is you're going to look at the blood smear under a microscope and you're going to see red blood cells that are not plump and round. Instead, they have a sickle appearance. Okay, so if you don't know what a sickle is, that's an old farming tool that they used to cut down grain. And what happens is because it's not that nice plump red blood cell, the sickled cells actually get clumped in certain areas. So what we're trying to do is we're trying to prevent sickle cell crisis. Okay, so what you need to understand here is that a patient with sickle cell anemia always has sickle cell anemia. What we are trying to prevent is them going into crisis. Okay, and crisis treatment is going to include antibiotics, pain management, fluid, oxygen, and potentially packed red cell infusions. Okay, sickle cell anemia can't be cured. Okay, you need to understand that this is not something that ever goes away. But our job as nurses is to teach our patients how to avoid crises. And so to do that is we want to keep them from going into vaso-occlusion. And the way that we support that is that we provide oxygen, we provide fluids to keep the blood nice and fluid filled so that we can move those clumps along. We provide pain management because this is overwhelmingly painful. Antibiotics because we're dealing with a patient with high risk for infection. And potentially those packed red blood cells. So signs and symptoms, okay, what you're going to see signs and symptoms wise, we're going to see all body systems are going to be affected. So brain, okay, because we're dealing with clumping, they're high risk for clots in the brain, they're high risk for hemorrhaging in the brain, they're high risk for stroke. In the eyes, we're looking at retinal and conjunctival hemorrhages, which can lead to blindness. In the lungs, it's not uncommon to see atelectasis. You could see a pulmonary infarct. Pneumonia, very, very common in sickle cell anemia. We're looking at individuals at high risk for heart failure. In the abdominal area, we're looking at hepatomegaly, high risk for gallstones, splenic enlargement, and maybe even an infarct in the spleen. Kidneys lose the ability to concentrate urine, so instead you have very dilute urine. They will diurese. And they're high risk for hematuria. The hands and feet, or the bones and joints, will get something called hand and foot syndrome, which means that the fingers and toes will grow at different lengths. The skin has high risk for stasis ulcers because we have impaired circulation. And in our male patients, they are prone for priapism, which means that they have a prolonged erection. Okay, so these are all the signs and symptoms that you're going to see for an individuals with sickle cell anemia. During the painful vaso-occlusive crisis, the patient may experience severe abdominal, thoracic, muscle, and even bone pain, low-grade fever. They're going to see increased jaundice, okay, and then in the occlusive crisis, they're going to have some very dark urine, and you may see a diminished spleen size with this patient as well. So what we're trying to do is that we are trying to prevent crises. So to do that, we want to avoid any risk of reduced oxygenation. So we talk to our patients about avoiding exposure to cold. Okay, so right now, it's very, very cold outside. So we are going to encourage individuals with sickle cell anemia to not go outside at this time of year. High risk for infection. So we want to encourage a lot of hand washing. We don't want them getting out and going to the grocery store right now, okay, because of high risk for infection. And we instruct them to avoid strenuous exercise. Now, I'm being very clear here. I'm not telling an individual with sickle cell not to exercise, okay? I am encouraging them to not partake in strenuous exercise. So no CrossFit, no training for marathons, for example. We can also prescribe them a low dose of penicillin prophylactically because we're high risk for infection. A patient with sickle cell anemia will usually undergo frequent transfusions, but as a result, that usually means that they're high risk for transfusion reactions. So we usually will not transfuse an individual with sickle cell anemia until their red blood cells and hemoglobin levels get lower than what we would expect a patient without sickle cell anemia. And they will also be prescribed a drug called hydroxyurea. Hydroxyurea is designed to prevent sickle cell crises. If it's taken appropriately, it does work in conjunction with the body so that they can prevent crises from occurring. Nursing diagnosis for sickle cell anemia, ineffective tissue perfusion, absolutely. If it is an actual crisis, if it's not a crisis, then it's risk for ineffective tissue perfusion. Acute pain, a lot of times when I have an individual admitted to the hospital with sickle cell anemia, it's usually for pain management. I cannot explain to you how severe the pain is when a patient is in sickle cell crisis. And risk for non-adherence to the regimen. With sickle cell anemia, usually because the patients are dealing with so much pain, it is not uncommon for them to develop intolerant or basically tolerance to the pain medications that they're prescribed. And so I've seen individuals who have to require larger and larger doses of narcotics. I have seen a lot of individuals who the narcotics don't work for anymore, and so they turn to street drugs to get the desired relief that they need. So risk for non-adherence to the regimen is a really common diagnosis as well. Patient education for sickle cell anemia, we teach our patients to avoid tight clothing because we're teaching them anything that can precipitate a vaso-occlusive crisis. So no tight clothing, no strenuous exercises. We want to make sure alcoholic beverages are in check, but we don't partake in a lot of alcoholic beverages. We want them to avoid cold temperatures. Smoking because of the vasoconstriction. We should not have them fly in an unpressurized aircraft. And what I mean by that are those little airports, like those little planes like the Williamson County Airport. Okay, that's an unpressurized aircraft. And exposure to infection. We want them to be very cautious of being around anybody who's sick and exposing themselves, like going to the grocery store is not a good idea when we're high risk for infection. All right, that wraps up sickle cell anemia.